somebody said recently at an event that I was at that how you treat and value your workforce effectively influences how they then go out and deliver services to the groups that we're working with. So, and that really made me think about workforce feeling confident, feeling trusted, feeling valued, and if they do feel like that, then I think they're much more able to go out and pass that on in the conversations that they have within the work that they're doing, and being able to really think about the standards and the principles behind them as part of that work. And it's a tricky thing to do, I think, and when you're delivering services and you're very focused on, the person that's in receipt of those services, but how do the people that are going out to try and do that feel, and how does the organisation support them, and how does that make them feel about themselves and their ability to go out and do what we're asking them to do.
That is really interesting, because as we were saying, you think about the principles and relate to the service user and not into the workforce, and we're really good at making sure that we're adhering to all the 5 principles for the service user, but maybe not always to well-being for staff and things at all times. We try to do a positive action for staff. We try and find a positive action for somebody, one member of staff at least per day, and it can be this little thing, just because I've had a really good caring conversation with a resident. We try and promote that, and that has really helped our staff, so that's really interesting. So maybe that's something that I'll take back and look at a bit more, in the future.
It's a really fascinating question to ask, because it starts, if you think that through so many of your activities in relation to the workforce in general, because the focus is traditionally and absolutely on the needs of the people that we support first and foremost, then it's not as if it's then the next thought you have is to the care and well-being, confidence, dignity, etc., your workforce. But if you apply that principle and think about it equally across both groups of people, I mean, at the end of the day, the thing that's absolutely clear about the 5 principles of the care standards is that they apply to people regardless. So you can't be compassionate towards the people you support, but not compassionate towards your staff who are providing that support. Or you can't be focused only on the well-being of the people that you support, but not on whether we're managing to keep our staff well at the same time. And I think that feels distinctly different from the previous national care standards, because they were focused on people having a particular range of needs. The principles as they apply now just apply to people, regardless of your circumstances or where people are and what they're doing, either whether you're receiving a service or receiving support, or the people in the end of delivering that. So it's actually quite an intriguing question that was posed
and it's really challenging.
Session you were in.
Yeah, I can think of in really small ways how some of that works, like within teams. I think if people have been through a really difficult experience within the team, if they've been working with a particularly difficult situation, and everybody's aware of that, you do tend to get that, once things have settled down a bit, because it's been so difficult, that conversation about, okay, right, how did that feel, etc.
It makes it much more obvious that there's a need to meet the needs of.
Yeah, but maybe we should do that a bit more often.
Yeah,
And
yeah.
somebody once described to me, as, you know, and it happened to me quite recently, somebody on the phone having quite a difficult conversation, and just out of the blue, a colleague came and sat a cup of tea down in front of them while they were on the phone, and it was that sense of, we realise that you're having a difficult time, and we're going to look after you a bit. You know, as a result of that. So it's that kind of, you know, we're a caring profession,
Yep.
but, you know, caring for ourselves and caring for our colleagues as well, and how we kind of embed that. And somebody else at one point had talked as well about recognising, just what you were saying, the kind of soft skills that your staff bring.
Yeah.
There's unique skills that they bring to the job that they do, and we're all different. But actually being able to say now and again, do you know what, you're really good at that, and I can see the difference that makes in what you do.
So maybe it's just really the caring conversations that we try and encourage with service users that we bring maybe to the culture when we're dealing with the workforce, and that's probably for us quite a cultural difference really to change, because we're very good at having caring conversations with service users, but maybe not always with each other.